Hello, I'm Dr. Tauhid Iqbal. I'm the consultant pediatrician and neonatologist in Lotus Hospital, Kukatpally, Hyderabad. Today, I will be talking in a brief about weaning of your babies and the complementary feeding. For first-time parents, weaning your baby off breast or formula milk to eating other foods might involve plenty of research and reading, which can be exhaustive. Today we will discuss in brief about the recommendation on weaning from the breast or formula milk and introducing your baby to her first food. Parents can start weaning after 5 to 6 months of age to satisfy the nutritional demand of the growing baby. Delaying it can increase the risk of feeding difficulties in your baby later on and also result in him or her receiving an inadequate amount of nutrition. On the other hand, the baby should not be weaned any earlier than 4 months of age, as their bodily systems, for example kidney and digestive systems, are generally not fully developed to process the food and convert them into nutrients. While breastfeed and our formula milk alone is enough to meet the nutrition need for your babies when they are 6 months of age or younger than that, some infants might need to kick-start the weaning process earlier, either due to suboptimal growth or mineral deficiency, for examples iron, which could have other implications as well. This should be done under the guidance of a doctor. When to start a weaning, apart from the age, take cues from your baby with regards to her readiness for the first feed. Your baby might exhibit some of the signs to indicate that he or she is ready to be weaned, like the baby should be able to sit steadily in an upright position with support and can hold head up, which will aid in spoon feeding. Your baby should be able to chew and shift food from front to back of the mouth to swallow. Stop sticking tongue out between the upper and lower set of teeth when swallowing. Show enthusiasm in food, like looking at your food or trying to take food from your plate. Drools and put items into the mouth more often. Cries for her feeds before the usual feeding time, which could be indicative of hunger. Iron fortified cereal is a popular first weaning food items, which tend to be well liked by many children due to the great taste and the frequent addition of milk to it. In addition, it is rich in iron, just like spinach, which is very important for the cognitive and behavioral development of your child. Your infant can start off with having it once a day for a few days before increasing to twice and even thrice a day. The other very popular weaning food item is pured pumpkin, which is naturally sweet and tasty. It is rich in beta carotene, we all know that, and many other nutrients important for the growth and development of your child. Other recommended first foods include pured spinach for its iron content and fiber to promote bowel movement, pured carrot and papaya, both of which are rich in carotene and high in fibers. And last but not the least, pured potatoes for its complex carbohydrate content, which can promote satiety and yet not cause excessive spikes in sugar level in your child. All babies' first food should be boiled to ensure that it is fully cooked, and then it need to be pured to consistency that is slightly thicker than the milk. The proportion of milk to solid depends on baby's age and also her developmental pace. The consistency of the food which is introduced also changes with the time. Here is a simple guide by the age. At 6 months or at the start of the weaning process, you can swap out one milk feed with solid food. Once your baby is used to bring food fed with solids, you can slowly increase the number of solid feeds to 2 times a day. At this age, milk should still be your child's main source of nutrition, and the total amount of milk whether it is breast milk or the formula, should be maintained at minimally 100 ml per kg per day. Food at this stage must be pured to a very smooth texture with no seasoning added. From 7 to 9 months, you can give your baby 2 to 3 meals with a solid food per day. Thus, the milk feed can be cut down by 2 feeds if your baby is taking the solid food well. During this age, especially after 8 months of age, your baby's food can be thicker in consistency so that he or she can practice chewing. This is an important developmental milestone for your baby in terms of building her own muscles and functions. As your baby becomes more accepting and starts to enjoy foods, solid foods, you can even give him or her finger foods to further develop chewing function and encourage your child to feed on their own. But always remember to supervise when they are eating. From 9 months to 1 year of age, your baby should be having 3 meals a day. Thus, the milk feed can be cut down by 3 feeds if your child is taking the solid meals well. Food does not need to be in the blended state anymore. You can try giving your child minced food or chop them into fine pieces. Seasoning should be kept to a minimal at this stage also. So here are some of the tips to make the weaning process easier. Have patience with your baby. That is very important. Expect that you will need more time for feeding, especially at the initial phase. Set your expectation on meanness while feeding. Try not to wipe your baby too often during feeding. Go with your baby pace. Offer food when he or she opens her or his mouth. If he or she refuses, you can always try again later on or on a different day when your baby is in a better mood. Do not force feed them. Try with small quantities of food at the start and increase when your baby shows a little bit of more acceptance. Do not discourage if your baby rejects new food types or taste. Rejection does not mean a baby permanently dislikes that food. Babies are known to take 15 or more exposure to accept a new taste. Most importantly, try to be relaxed. Mealtime should be a happy time for both the parent and the child. Last but not the least, do not compare your baby's progress to others. We all are different. Thank you.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers, Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.